Now let us discuss epidemiology, clinical features, and histopathology of pleomorphic adenoma. Pleomorphic adenoma is mostly seen in 4th to 6th decade of life. According to some studies, the average age ranges from 43 to 46 years. It is seen more in females than males. It is common salivary gland tumor in both children and adults. Around 65 to 85% of benign tumors of parotid are pleomorphic adenomas. According to some studies, 40 to 50% of all salivary gland tumors are pleomorphic adenomas. Parotid gland is common site of pleomorphic adenoma. 90% of pleomorphic adenomas in parotid are seen in superficial lobe. Swelling is seen overlying mandibular ramus in front of the ear, and 10% of parotid tumors are seen in deep lobe of parotid gland. Around 10% of pleomorphic adenomas are seen in submandibular glands. 5 to 10% of these tumors are seen in minor salivary glands. Palate is common site of pleomorphic adenoma in case of minor salivary glands. Lip and buccal mucosa are less involved. Very rare location of pleomorphic adenoma include lacrimal gland, breast, mandible, neck, and lymph nodes. Dumbbell tumors are pleomorphic adenomas involving parapharyngeal areas. A narrow isthmus connects two components of the tumor, involves lateral pharyngeal wall, and displaces oropharynx medially like other parapharyngeal tumors. Coming to pleomorphic adenoma in tail of the parotid, it presents as slow growing painless mass. It is firm in consistency. The earlobe gets elevated. Pain and facial palsy is rare, and it doesn't show fixation to deeper structures. The pleomorphic adenoma of palate presents as dome-shaped swelling. There is difficulty in mastication, talking, and breathing. It is small in size, only few centimeters. The swelling is immobile. It is detected earlier and so is treated during initial stages. Macroscopic features of pleomorphic adenoma are that it is covered by capsule. This capsule can be complete or partial. The capsule varies in thickness in different areas. The cut surface of pleomorphic adenoma is hard, rubbery, and the color is whitish gray or yellow. The tumor has nodular areas. These correspond to myxoid or fibrotic growth. More the number of nodules, more the tendency of recurrence. Coming to microscopic features. Here we are seeing epithelial and stromal component. The epithelial component contains ducts, tubules or trabecular areas. Also, solid sheets of cells, strands and islands of cells are seen. Here we are seeing myoepithelial component in upper area. Angular spindle-shaped cells or plasmacytoid cells are seen. The lower area of this picture shows ductal cells, tubular structures, cystic spaces, sheets and strands of cells. It is epithelial component. Here in this pic we are seeing both stromal and epithelial components. The stromal component contains prominent chondroid area. The epithelial component shows sheets of cells which are arranged as trabeculae or sometimes in the form of islands. We'll discuss differential diagnosis, treatment, recurrence, and pleomorphic adenoma in next session.